When it comes to vaping or bringing vapor into the body, it's important to understand exactly what happens once that vapor enters. We often assume we're just inhaling air, but the truth is that when we inhale vapor or cigarette smoke, it follows very specific pathways through our body that determine how it can affect our health. If we look at the anatomy of the head and neck, air can enter either through the nose or the mouth. When we breathe through the nose, it passes into the nasal cavity, which is divided into two sides by the nasal septum. Air coming in through the mouth enters the oral cavity. Both of these passageways lead to a shared region at the back of the throat called the pharynx. From there, the air, or in this case, vapor faces a fork in the road. One route, the esophagus, leads to the stomach and is meant for food, not air. The other route is the trachea, or windpipe, which carries air into the lungs. The trachea is held open by a series of C-shaped cartilaginous rings that prevent it from collapsing, allowing us to breathe continuously. The esophagus doesn't have these rings because we only use it during eating. Following the trachea downward, it eventually divides into two main branches called bronchi, one going to the left lung and the other to the right. These bronchi continue to branch into smaller tubes known as bronchioles, which then lead to microscopic air sacs called alveoli. These alveoli are extremely thin, only 1 cell thick, and are where the exchange of oxygen and carbon dioxide takes place. This is the most delicate part of the respiratory system and the area most affected by vaping. So, what exactly is vaping? It began with the electronic cigarettes, which were originally designed to mimic traditional smoking, but technology has advanced rapidly. Modern vaping devices are larger, rechargeable, and use cartridges filled with a liquid that is heated by an atomizer to create vapor. When this vapor is inhaled, it enters the respiratory system and thus like air or cigarette smoke. But is inhaling that vapor harmful? Unfortunately, it can be. In recent years, hospitals have seen an alarming increase in patients suffering from a type of acute lung injury linked to vaping. This condition has been officially named e-cigarette or vaping product use-associated lung injury, or EVALI for short. Many of these patients presented with symptoms that looked very similar to pneumonia fever, chills, cough, chest pain, and shortness of breath. In some cases, patients even coughed up blood, a symptom known as hemoptysis. However, when doctors tested these patients, they couldn't find any bacterial or viral infections. The common factor among all of them was recent vaping use. Interestingly, up to 80% of EVALI patients also experience gastrointestinal symptoms like nausea, vomiting, diarrhea, and abdominal pain. This indicated that vaping could have systemic effects beyond the lungs. But what exactly was causing the damage? Investigators began analyzing the liquid used in vaping cartridges. Because the vaping industry is tightly regulated, the ingredients can vary greatly between manufacturers, but researchers have found some common substances. Most cartridges contain nicotine, which is addictive, as well as humectants, such as propylene glycol and glycerol, which help keep the liquid moist. Others include tetrahydrocannabinol (THC), cannabidiol (CBD), and vitamin E acetate. Some products even contain traces of metals like tin, nickel, chromium, manganese, or arsenic, and over 7,000 flavoring chemicals have been identified across different brands. Doctors wanted to know which of these ingredients were most dangerous. When they examined patients in hospitals, many showed rapid heart rates, rapid breathing, and low oxygen levels. Imaging scans often revealed cloudy patches in the lungs known as opacities, similar to what you'd see in pneumonia. To investigate further, doctors performed a procedure called bronchoalveolar lavage. In this procedure, a small camera is inserted into the airways, and sterile saline is injected deep into the lungs. The fluid is then suctioned out and analyzed. In patients with EVALI, researchers repeatedly found vitamin E acetate and THC in these samples. This finding raised an important question: How could vitamin E, something often considered beneficial when applied to the skin or taken orally, cause harm? The answer lies in how it's delivered. When consumed or applied to the skin, vitamin E is processed through the digestive system or absorbed through the epidermis, both of which are equipped to handle it safely. But when inhaled into the lungs, it behaves very differently. Vitamin E acetate is oily and thick, and it can coat the inner lining of the airways and alveoli, interfering with the lungs' ability to exchange gases and triggering an inflammatory response. Researchers don't yet fully understand the mechanism, but because of the strong correlation between EVALI and vitamin E acetate, the Centers for Disease Control and Prevention (CDC) has recommended that manufacturers stop using it in vaping products. They also advise avoiding cartridges that contain THC, which is often found alongside vitamin E acetate in cases of EVALI. Between 2019 and early 2020, the CDC recorded 2,807 hospitalizations to EVALI, with 68 confirmed deaths, a mortality rate of about 2.4%. This doesn't mean that 2.4% of all vapers die, but rather 2.4% of those who develop EVALI. The majority of patients survive and recover, though hospitalization is often required. Treatments typically begin with antibiotics until infections can be ruled out. Once confirmed that it's not pneumonia, supportive therapy becomes the mainstay. This can include supplemental oxygen, anti-inflammatory steroids to calm lung inflammation, and, in severe cases, mechanical ventilation. Most patients begin to feel noticeably better within about 2 weeks, though full recovery can take several more weeks. The long-term consequences are still unclear, as vaping is relatively new and long-term data are limited. This brings us to the comparison between vaping and traditional smoking. While most experts agree that smoking tobacco is more harmful overall, vaping is not without risk. Cigarette smoking has been studied extensively for decades and is known to cause cancer, heart disease, and chronic obstructive pulmonary disease (COPD). Vaping hasn't existed long enough for researchers to know its full long-term impact, but the EVALI outbreak showed that it's far from harmless. If a patient tells their doctor they want to quit smoking and asks whether switching to vaping might help, the doctor would ideally recommend quitting entirely, perhaps with nicotine replacement therapy or other medications that are proven safe and effective. But if the patient refuses medications and insists on choosing between cigarettes or vaping, the doctor would advise switching fully to vaping without mixing both because it likely poses fewer risks to the lungs than smoking tobacco. However, for people who have never smoked, vaping is not recommended. The safest option is not to inhale any foreign substances into the lungs. Unfortunately, vaping has become especially popular among teenagers and young adults, raising concern that it could become a gateway to smoking. Studies have shown that those who vape are more likely to try cigarettes later, which could lead to even greater health risks. The message is simple: if you must vape, avoid products containing vitamin E acetate or THC, and if possible, avoid vaping altogether. You only get one set of lungs, and they're worth protecting. If you're interested in the science behind how all of this works, that's where today's sponsor, Brilliant, comes in. Brilliant is an interactive learning platform for science, technology, engineering, and math. It teaches through hands-on lessons that help you think creatively and apply concepts to real-world problems. Whether you want to understand the physics of airflow through the lungs, the chemistry of vaporization, or the math behind drug dosages, Brilliant has you covered.